Hello. Welcome back to Medical Curiosity Channel. Today we will be exploring the ever-deadly virus called human immunodeficiency virus. Scientists later traced it back to a moment in the early 1900s when a virus from chimpanzees crossed into humans. Fast forward to the late 1970s. Doctors in the United States and Europe began seeing something strange. Young adults arrived at hospitals with rare infections that usually appeared only in the elderly. The medical world was confused. The cases kept rising, and the pattern was unlike anything doctors had seen before. In 1981, the CDC published the first official report describing the mysterious illness. The public called it AIDS. Scientists knew almost nothing about how it spread, and fear filled the gaps where facts were missing. Stigma grew fast. Communities were shaken. The epidemic had begun. In 1983, researchers finally identified the cause: the human immunodeficiency virus, HIV. This discovery became the first ray of hope. For the first time, doctors had an actual target. Laboratories began working non-stop. Activists marched, demanding research, funding, and justice. The movement around HIV became one of the most powerful public health efforts in modern history. The first treatments arrived in the late 1980s. They helped, but they were harsh and limited. Then came 1996, a breakthrough year. Combination therapy transformed HIV from a fatal diagnosis into a manageable condition for many people. Patients who once had months to live suddenly had decades ahead of them. HIV reshaped how the world handles public health. Nations created global programs to provide medication, education, and testing. Countries across Africa, Asia, and the Americas saw massive improvements as treatment became more accessible. It was a reminder that health is not just a national issue, it is a worldwide responsibility. Beyond science, HIV changed conversations. It forced the world to confront stigma, discrimination, and misinformation. It pushed medical research forward, speeding up progress in vaccines, antiviral drugs, and public health strategies. It taught humanity the importance of compassion and the power of awareness. Today, millions of people live long, full lives with HIV. Treatments are better than ever. Prevention tools are stronger. Scientists are working towards something once thought impossible: an actual cure. The story of HIV is still being written. It remains one of the greatest medical challenges in human history.